This is your source for local news in the Heartland.
This is KTVO's Good Morning Heartland.
Good morning. It is 6:27. With school in session, a lot of your children are no doubt involved in school activities, including sports. But with that comes the chance of getting injured, whether during practice or during a game. So we brought in the expert, Dr. Kevin Marberry, to talk about sport injury prevention and pretty much what you can do maybe before and after if you do get hurt.
That's right. That's right. Well, I first of all, I certainly appreciate being asked to come here and talk about injuries. This is a really important thing that we are discussing right now. As you mentioned, especially since the start of the school season is going on now, and football is in session, basketball will be starting pretty soon. So, you know, the things that we want to get out there and want to be concerned about are injuries that can occur with these activities.
What kind of injuries are we talking about?
Well, you know, really technically anything can be injured with sports. The most common injuries that we see in our clinics are they have to do with ankle injuries, knee injuries, and of course shoulder injuries. And I think the ones that we are talking about today in our segment are going to be the knee injuries and how to diagnose those injuries and come up with ways to prevent those injuries if we can.
Okay, and now do you feel like this time of year, because I know sports are all year round, but with school starting, maybe some kids are starting sports for the first time. Do you see an increase in injuries this time of year than in later part of the year? Yeah,
you know, I think just at the beginning of the seasons, those are typically the times when people are going from relatively sedentary activities to high performance activities, and going from that transition can sometimes be a little bit awkward for people, but you know, as their bodies get used to the certain movements that are involved in these high-impact sports, the injury rates tend to taper off just a bit at the later parts of the season.
Okay, so we brought something here today. What is this called?
Yes, we did. This is a plyo box, and this is and I brought one of our athletic trainers as well. I don't know if we can bring her into the segment now.
This is Jess.
Jess Bergeson. She is the head athletic trainer for Kirksville High School. Football team is undefeated at this point, which is good. So what we wanted to talk about was a way that we can help to find athletes who may be at risk for developing a knee injury, a certain type of injury called an ACL tear.
Okay.
And the ACL is a strong ligament that sits on the inside of the knee joint that holds it together. And with certain movements and activities, that ligament can be at risk for tearing. And once it's torn, it's actually a fairly devastating injury in young athletes. So what we use, this is a plyo box. We use this to have the young athlete jump off the box, and we watch the way that the knees move when the athlete lands and then jumps again. So Jess can sort of demonstrate this here if we can get that on camera.
Just careful, there's a step right over there. It blends in, but
don't fall off.
Don't fall off the stage.
And don't tear your ACL when you're doing this. But no, so we'll ask the athlete to slowly jump off and then rebound and jump again. So if you can demonstrate that. And so what we do is we set up cameras in front and on the side of the athlete, and we just watch the knees as they land. And if the knees tend to buckle in, then we've found that athlete may be at risk for developing a knee injury later in their athletic career.
Okay.
And so we try to come up with ways to compensate for that deficiency. And that's where our athletic trainers come in, that's where our physical therapists come in, and we really set up a sort of a multidisciplinary approach to reducing the risk of developing this knee injury in the athlete.
All right. Well, thank you so much for coming on. Thank you so much for being our model. I appreciate it. And of course, we will post this on our website later today with information about your practice. So thanks again for coming on.
Thank you very much.
And we'll be right back.